we have? Just a few.
We're looking at
Okay.
Anne and Bernadette.
So I want to talk, we're kind of doing a little bit of a series. Sharon talked about sleep. I don't remember what specifically about sleep. And Dr. Buka Putnam didn't make it, but she was supposed to have talked about sleep, and maybe she'll come back and do that. And I'm talking about sleep disorders and heart health. And then Linda Good next week is doing different treatments for sleep disorders. So let's get started here. So adults should get 7 to 9 hours of quality sleep.
No time.
Oh, on Zoom, it's not advancing?
And show your performance.
Okay, we're having a little bit of a, make sure our Zoom people can see this as well. Um, you guys, well, no, Paul, you would be seeing the same thing everyone else on Zoom. Well, let's just have a discussion while Leanne's figuring this out. So 7 to 9 hours of quality sleep um, is ideal to reduce risks of high blood pressure, obesity, stroke, and cardiovascular disease. So the question is, so how much sleep did you get last night? You got 5 hours. Five. 5.
I got 9.
I got 7. How much?
7.5.
7.5. Students, the younger, 7.
Damn, and I do my lunch late.
Okay. Still is not. Yeah, so why is that? Why did this little group in here only get 5 hours of sleep?
Mask.
Okay, so you wear a CPAP, mask coming off, Mary?
I was doing some artwork and I stopped.
Oh, you've got a full life. Okay. Anyone else? How many hours did you?
Getting up to go pee and all that.
Oh.
You have to take it at a certain time. And you don't always go to sleep, when you. So.
Yeah. So if you get up in the middle of the night to use the restroom, it's hard to fall back to sleep. Yep.
So, ¿qué es la problema? What's your problem?
Zoom, people are not seeing the slides advancing.
Good thing Paul's in the crowd.
I know. Paul is like the barometer. Ooh!
Sometimes I get up every night.
Yeah.
My phone is ringing.
Thank you, Mary. I wanted to say that I said that.
Smells is good. So I think you have this open in multiple places. Is that kind of the issue here? That's one of the issues I'm thinking is the issue. So.
Good job.
What did she say?
Look at all the seniors being techie.
Oh, good grief.
All the way down, sleep.
No, let's not do it off your USB.
Well, I haven't downloaded the newest into, I haven't downloaded it.
Yes, you have. You did have it, but I didn't.
From this morning?
Yeah.
Okay.
How about now, Paul?
Okay, but advance it. Let's see. How about now? Okay, now we're good. Okay. Sorry about that. Okay, so did anyone else join us? No. Okay. So the American Heart Association has Life's 8 Essentials. This is something new in the last few years. It introduces an enhanced approach to assessing cardiovascular health. So Life Essential 8s, which include, now we're going to know most of this because we base our whole lives on this, right? Diet, our physical activity, nicotine exposure, body mass index, or that's our weight, blood lipids, which is cholesterol, blood glucose, blood pressure. We know all this. All this is related to our heart health. But the new thing that was added was sleep health. So it's important, right? Now, as I was creating this PowerPoint, I kind of was losing sleep over it because the more you know, right? So key insights on Life Essential 8s. I'm like, we just want a good night's sleep. And then it's like, how many hours? Well, now let's stay awake at night wondering if we're doing this because duration matters. So both short and long hours of sleep durations are linked to higher risks of cardiovascular disease and cardiometabolic issues. So now we're looking at duration, like getting up every couple hours to use the restroom. Are you falling right back to sleep? Are you staying awake? Kind of that whole duration. I'm kind of that 3 a.m. person, and I'm up for a couple hours, hour and a half, and then maybe I can fall back to sleep. Sometimes I don't. Quality and consistency. So poor sleep quality and high variation in sleep wake timing, like that irregularity, are strongly associated with a higher cardiovascular risk, with consistent better time sleep associated with lower mortality. So, okay, just giving you something to keep you up tonight. Disorders and symptoms. So excessive daytime sleepiness, which for the student who got 3 hours, she may be sleepy today. Insomnia and obstructive sleep apnea are flagged as significant contributors to cardiovascular disease, coronary heart disease, and stroke. Behavioral focus. So poor sleep should not be accepted as a fact of life, which think about this like 10 years ago. I'm a poor sleeper. Yeah, I just don't sleep well. And that's all it was. But the more you know, the more we have chances to improve our sleep habits, or we can stay at night thinking about duration, quality, disorders, behavioral focus. That's what I'm kind of thinking. But we've got ways to actually help you. So poor sleep should not be accepted as a fact of life. Behavioral changes, like establishing a consistent sleep schedule and improving sleep hygiene, are crucial preventative strategies. The American Heart Association stresses that sleep is a multifaceted metric covering duration, regularity, timing, quality, and alertness. So it's not just sleep. There's a whole science behind this. So key cardiovascular effects of poor sleep. So the lack of sleep, so less than 7 hours, harms the heart by triggering chronic inflammation, increasing stress hormones like cortisol, and keeping blood pressure elevated rather than allowing it to drop at night while we're in slumber. This increases risk for high blood pressure, coronary heart disease, weight gain, and up to 20% higher chance of a heart attack. So I'm kind of curious. I just want to stop there. And who in here has actually talked to their doctors about the quality of their sleep? Wow. And what was the response? Melatonin.
My doctor sent me immediately to a sleep study,
Oh, okay. And
and the first test that I did, I had 50 sleep disturbances per hour at the time. So I was sleeping like 1 minute at a time. It was crazy.
Yeah.
So CPAP immediately, all that, yeah.
okay, that's huge. So being able to identify that and then using CPAP, we know through studies that that does lower your cardiovascular risk. You just get better sleep, better quality sleep.
I should say, there's a trick to that, is my boyfriend started complaining that I was snoring at night,
Yeah.
and I was like 55 at the time. And I said, you are out of your mind. I don't snore. What's wrong with you? And he went on and on and on, and he nagged and nagged and nagged. And he said, Bonnie, you're waking me out of a sound sleep because you're stopping breathing in the middle of the night. I was waking. You know how mothers can tell when babies aren't okay?
Oh, yeah.
It was that thing. And I finally went to the doctor about it just to shut him up because I thought he was nuts. Truly. And the doctor said, oh my God.
Sleep study.
Yeah.
Yeah. So Bonnie was just sharing for those of you in Zoom land that her partner was very concerned because he knew that she was snoring or actually had some sleep apnea and she thought he was nuts, which was a good assessment. But she thought she
He's
would
a man in the middle of the night.
So she actually went to the doctor hoping just to keep him quiet, but the doctor directly sent her to a sleep study and she does have some sleep apnea and now she's on CPAP, which is a way to get better sleep, better quality sleep, and that does lower your cardiovascular risk. So good for you. Good for you. Yeah. Anyone else? What'd your doctors say when you went and told them? It was what? You got some type of sleep aid though? Okay. Yeah. Well, that's not without risk as well. Michael.
Anybody know?
Oh, on your smartphone, yeah.
Yeah.
Anyone else? Your iPhone or your watch can track your sleep as well. Yeah.
The men's diet shows you how long you spend in each level.
Yeah. Yeah.
Shows you over the project, you just wait like 4 minutes of deep sleep.
4 minutes of what?
Deep,
Deep sleep.
you can see the 30 minutes. But 30.
Yeah, it gives you a lot of detail. Yeah. So technology can definitely be a big part of it. One of the other talks that I've done, and you can find this on the YouTube channel, I reviewed a lot of those technologies, the Coral, I don't know if I'm saying it right. The ring that also monitors your sleep as well. Yeah. So we can review that talk because we talk about technology and how it can assess your sleep as well and the quality of your sleep. So let me just review this. So, yeah, not having enough sleep increases your risk for a lot of things, right? And more. So, like I said, high blood pressure, when you get a good quality night's sleep, your blood pressure falls. So, if you're not getting that, your blood pressure stays up, your vessels get stressed, leading to sustained high blood pressure. So, there's this domino effect when we don't get that good quality sleep. Also, chronic inflammation and plaque are affected as well. So, lack of sleep increases white blood cell production, causing inflammation that leads to plaque buildup in the arteries. This is called atherosclerosis. It's the beginning of heart disease. So, it's all tied in. The quality of your sleep, the number of hours of your sleep directly impacts your heart health. So there's also an increased stress response. So when you think about fight or flight, we're talking about your sympathetic nervous system and your parasympathetic. So not getting enough sleep keeps the body in that fight or flight mode with increased cortisol and disrupting heart rate stability. Heart damage risk, habitually sleeping less than 6 hours a night is linked to a 20% higher incidence of heart attack and increased risk of stroke. But there's also a metabolic disruption. So poor sleep impacts hormones regulating hunger, leading to overeating, obesity, and diabetes, which further stresses the heart. I tell you, I'm getting stressed by just even creating this PowerPoint and thinking about my quality of sleep, though I slept really well last night. So let's go a little bit deeper about how sleep disorders affect your heart health. So we know poor sleep can cause major CV disease risk, including obesity and diabetes. Irregular or insufficient sleep can negatively influence your diet, stress, and other lifestyle factors that can raise your risk. And excessive daytime sleepiness, which is a symptom of many sleep disorders, including hypersomnia, which means excessive sleepiness during the day, can lead to a greater risk of cardiovascular disease. And poor sleep and sleep disorders can cause depression and other mental health issues, which can hurt your heart health. Who wants to throw in the towel? But there's more. So let's talk about obesity, diabetes, and depression, which all affect your heart. So sleep disorders and obesity. So I found out some things that were really kind of shocking. Sleep loss creates a hormone imbalance that promotes overeating and weight gain. So there's hormones called leptin and ghrelin that regulate appetite. And when you aren't getting sufficient sleep, the production of these hormones is altered in a way that creates increased feelings of hunger. I think I knew this. Did you guys know that? Okay. Sleep deprivation is associated with growth hormone deficiency and elevated cortisol levels, both of which have been linked to obesity. It also can affect impair the metabolism of your food. I knew that as well. This is what I did not know. So restricting, just a second, restricted sleep duration has been shown to cause a greater tendency to select high-calorie foods. That's scary to me. Calories consumed late at night increase the risk of weight gain. Adults who do not get sufficient sleep get less exercise than those who do, possibly because sleep loss causes sleepiness and fatigue during the day. But the idea of selecting high calorie foods is not a good thing. But you know what? I'm thinking about like last night. I was still kind of hungry before I went to bed. And I just ate a piece of sourdough bread with butter on it. And I knew I wouldn't be able to fall asleep being hungry. And so it makes me just think about, at the end of the day, do we reach for higher calorie foods? Do you see that in yourself? Like I did not want an apple. I did not want grapes or carrots, but sourdough bread sounded really good. How about you guys? Anyone can speak to that? Or am I the only one that will admit it?
I think you're looking for the energy that consciously.
I don't know. I don't know. I'm glad I didn't have M&Ms in the house. Sleep disorders and diabetes. So let's just jump right into that. So there's substantial association between poor sleep quality and metabolic syndrome, insulin production, fasting glucose levels, and insulin resistance. You've heard of metabolic syndrome. It's it's what you would get right before you're diagnosed with diabetes. So once you have diabetes, you have diabetes. But right before that is metabolic syndrome. And we're kind of looking at having kind of the apple shape, carrying the weight in your trunk so that, there's a pear shape and an apple shape. So it's that apple shape. It's insulin resistance. It's higher blood sugars, hypertension, higher triglycerides, and low HDL. So if you have 3 of any of those 5, it's basically your body saying the next step is diabetes, but you're at a phase where you can turn this around by addressing some of those things, like being able to lose weight or being more active or watching the things that you're putting in your mouth.
Is that pre-diabetes? Is that pre-diabetes?
It's along the same lines. This is called metabolic syndrome. Once you have diabetes, you have diabetes. So treating sleep. Did you have a question?
That's assuming not being free. And once you're on insulin, then you those things.
Yes, exactly. So yeah, and you have no pain and you're loopy as heck. Right. So Mike brought up a really good point. So we're talking about sleep disorders and diabetes, but is it managed diabetes? What's your hemoglobin A1C? So that's a good point is whether or not just having diabetes, but is it managed? Because that will lower your risk for sure. So treating sleep disturbances in patients with type 2 diabetes may prevent diabetes from progressing. In addition to directly impairing sleep due to nocturia, sleeping, using the restroom a lot at night, polyuria, diabetic neuropathy pain. Type 2 diabetes has also been linked to obstructive sleep apnea, cardiovascular complications, hypertension, stroke, and depression. So healthcare providers treating patients with diabetes should pay special attention to sleep problems and poor quality of life caused by these conditions. So I'm curious, anyone who has diabetes, does your doctor talk to you about your sleep? Mike, did your doctor ever talk to you about your sleep habits? Yeah. Okay, good. Good. So you're really on top of it, but just know that if you have diabetes, that's something that your doctor should be asking you about, or if you're proactive, you are taking making sure you're staying managed well, keeping your numbers managed well. But if you're not getting good sleep, that may start affecting your blood sugars.
Um, I have issues with sleeping, but most of it's in the dream states that are confused now. And I asked the doctor, I'm pre-diabetic, and he said, let's do a sleep study. And we've already done one. They said, what are people going to find out in the sleep study? Nothing is sleep apnea. Because if sleep apnea isn't your issue, what are we missing?
Oh, that's a good question.
That's
Okay.
what the doctor cares about.
So the question was, the doctor wants to do a sleep study, but if they're not looking for sleep apnea, what else could they possibly be looking for? So the only thing I can really speak to is there may be other things. I'm not sure what that would be, but sleep apnea is such a major risk factor that we can do something about that. That's like the big, pink elephant in the room that we have to address. And the other thing I wanted to bring up that Bonnie said, and I think is really important, that if you're alone in your bed at night, no one knows that you're snoring unless you're sleeping with somebody, right? Because I'm sleeping beauty, right? Until I go travel with friends and they're like, Jesus, Cari. I'm like, what? Me? Here's earplugs.
App, I think it's called Snore or something like that. And you just, on your phone, and you press the button and then you set it down and it will record when you snore. And you can actually hear yourself. You can see how long it lasts. And you can also hear if you were to snore and then suddenly have quiet.
Yes.
Having some apnea episode. So, I'll look it up when you're talking.
Well,
I think it's called Snore Lab.
Snore Lab. Okay, that's great. There's also, okay, what?
Tell Zoom what she said.
So Sharon said that there's an app that you can get on your phone that's free, and she thinks it's called Snore Lab, that you can just open up that app while you sleep at night, and it will monitor the noise you're making or the absence of noise if you have sleep apnea. So if you don't have a partner in bed with you, that may be one way to find out if you are snoring or not. That's great. Technology is our friend, and it can determine a lot of things that and bring to our attention that we're not aware of. Thanks, Sharon. So make sure your diabetes is under control. So sleep disorders and depression and cardiovascular risk. So depression and sleep disorders have a bi-directional relationship. So I'm going to explain that. Where insomnia or hypersomnia can both cause and result from depression. So I'm depressed, I'm not sleeping well, or I haven't slept well, and now I'm depressed. So it's bi-directional. Insomnia is the most common issue affecting almost half of the population of the people with depression, while sleep problems like insomnia increase the risk of developing depression. So treatment often involves a combined approach such as medication, therapy, and improving sleep habits. You can't just let it go, right? But how? How does just having depression? That's the question I was asking myself. So if you have depression, why does that increase your CV risk, right? It does by triggering chronic inflammation, elevated stress hormones like cortisol, promoting unhealthy behaviors. Like maybe if you have depression, you may be drinking alcohol or maybe smoking or eating poorly. It increases your blood pressure, increases heart rate, and it promotes stickier blood platelets that damage arteries and increase clotting, creating a direct pathway to cardiovascular disease. That's what depression does.
I don't know if this is about like depression, but is it like a heavy depression, mild, is it a mild depression or
Just depression. And yes, treating depression can reduce your CV risk and improve outcomes for those with existing heart disease. So it's not something you just sit on. Here's another thing that was a little staggering. Notably, people who are diagnosed with both depression and anxiety face roughly a 32% higher risk compared with those diagnosed with only one of those conditions. Importantly, these associations remain strong even after accounting for differences like lifestyle behaviors, social economic factors, traditional risk factors such as smoking, diabetes, and hypertension. That's kind of scary. Okay, so my next question as I was creating this is, well, freaking take a sleeping pill and let's just be done with this, right? Well, so my question is, do sleep aids help or hurt? What is the effect on your cardiovascular risk? Because we can take something and make ourselves fall asleep. But is it the quality of sleep that we need that's going to lower our CV risk? I thought that was a really good question. Don't rain on my parade, Michael. You're stealing my thunder, dude. I'm going to talk about, those are good. That's exactly, that we went down the same rabbit hole because it does matter what you take. Exactly. So, but let's start general, then we'll go specific. But if you want to come sit up here, okay. While good sleep is essential for heart health, most pharmacological sleep aids do not inherently lower cardiovascular risk, and some, particularly long-term, may increase it. Okay. Evidence suggests long-term melatonin use is associated with higher heart failure risk, whereas treating underlying sleep disorders like sleep apnea using a CPAP will lower it. So it does depend on what you take. So melatonin's great short term. Don't go into this long term. Definitely something to talk to your doctor about. Bonnie, I think you talked about someone. Oh, you did, Nancy.
I found out.
Yes, that's the thing. Like melatonin, we can buy it off the counter. But somebody needs to be looking at the other medications we take. Is there going to be a counter? Are they contraindicated? And short term versus long term makes a difference. But let's talk about other sleep aids, right, Michael? Because what are we taking? Let's talk about Ambien. I know a handful of my friends that are taking Ambien. I'm like, what? I was always afraid of, you heard those stories about people eating, going into the refrigerator and eating in the middle of the night and not even being aware of it, or falling asleep on an airplane after taking Ambien and running down the aisle naked, just I didn't do that. That I recall. No. So Ambien does not typically lower cardiovascular risk. In fact, study shows it's associated with an increased risk of cardiac arrhythmias, particularly AFib, tachycardia, and flutter. So we got to be careful. And that's why, well, first of all, Ambien is a prescription. So you're going to be talking to your doctor anyway. So your doctor's going to do a full evaluation whether you'd be a good candidate for Ambien, not long term. Some studies suggest potential benefits for sleep quality in specific populations like heart failure patients. It is not recommended treatment for reducing overall cardiovascular risk. So we have to be careful with, Ambien will help me sleep, but is that sleep going to lower your cardiovascular risk? Ambien's probably not your choice, and it's not without some harmful effects, potential harmful effects. So experts generally recommend that adults 65 and older avoid or stop taking Ambien due to increased risks of side effects, including cognitive impairment, dizziness, and dangerous falls. For older adults, the drug can cause severe confusion or increased sensitivity, necessitating at minimum lower doses if used. Okay, so Ambien's kind of a live wire there. Got to be very careful. There can be an addictive, but if you're over 65, I'd be questioning why is the doctor still prescribing? What? Wrong doctor. Okay, what about magnesium? So Dr. Bukapatnam talked a little bit about magnesium, and again, you can get it over the counter. I didn't realize that my graphic here was gummies, magnesium gummies, but it looks promising, but let's just talk about it. So magnesium supports sleep by activating the parasympathetic nervous system to relax muscles and regulate GABA, a calming neurotransmitter. Okay, so something to kind of think about. Supplementing with 320 to 729 milligrams of magnesium citrate or oxide can improve sleep duration and reduce latency, particularly in older adults. It lowers CV risk by reducing blood pressure, managing arrhythmias, and decreasing inflammation. So I am not getting paid by the magnesium people to say this, but I will say this. Always consult your healthcare professional before taking it, because you can buy this at CVS today. But someone said, is it contraindicated with other medications you're taking? There's something else also. Let's go one more slide. Magnesium and CV risk reduction. So blood pressure regulation. Research shows that 300 milligrams or more daily can lead to a significant reduction in the systolic and diastolic blood pressure, particularly in people with type 2 diabetes. Arrhythmia management. It assists in regulating heart rate and preventing arrhythmias. Arterial health. Magnesium prevents arterial stiffness and calcification, improving blood flow. And also inflammation reduction. It helps lower inflammation responses in the body that can lead to atherosclerosis. But you're going to talk to your doctor. You're not just going to buy it and take it. Consult with your healthcare professional, especially if you have kidney disease. Do you know if you have kidney disease? Or are taking other medications, as magnesium can interact with them. So it's not something you just start on your own, though it does look like it does have a lot of potential benefits. Is anyone taking magnesium? Oh, the kid in the room. 2 kids in the room. 3 kids? Why are you taking it? Is it? I mean, does it help you?
Yeah.
Okay.
It's like sleep anxiety, I would say. It can help you stay asleep.
Okay. Same.
It's supposed to be good for you.
My doctor prescribed it to me because I wake up with horrible leg.
That,
has helped.
yeah. Well, have you noticed your quality of sleep?
Still dreaming.
But dreaming is good. You're in a good state if you're dreaming.
Depends on
Cari,
Yeah.
what did the first two, you said kids or whatever, who
Oh,
were
there's
taking,
students in the room were the ones that raised their
right?
hands saying that they take magnesium, and they said it helps with sleep. One said he heard it was good for him,
Okay.
but
And
someone else in the room had restless legs. Oh no, leg cramps.
right.
Leg cramps, which helped.
Yeah.
It did help.
And what I've heard recently is that if you're taking it for calming purposes or sleep or whatever, they emphasize magnesium cyclinate I believe it is, rather than the citrate or oxide. And I think that's mainly to avoid the, I don't know how to put this, but overactive digestion process that magnesium can, like milk of magnesia or whatever.
Yeah, I did not differentiate between I can't speak to that because I would say talk to your doctor about it.
Okay.
Yeah, for sure. Talk to your doctor about which, if it's something you want. So now this isn't right. We're always going to talk to our healthcare providers, our healthcare team before we start anything, any type of supplement. Okay. Yeah, go ahead.
What about foods that contain magnesium? Is that what eat more of those help or eating foods that have or that have magnesium? Or...
Oh yeah. Yeah. In fact, I think Debbie talked about that, eating your dark green leafy vegetables that have higher concentrations of magnesium. It's definitely a good thing. Yeah, you don't need to talk to your doctor about should I eat more vegetables. So my next question while I was creating this is what about a sleep gummy? You know that has cannabis, THC in it, because we know that has can help with sleep. That's what all the commercials say. So cannabis gummies, particularly those containing THC, are used to improve sleep, but they do not lower cardiovascular risk. So again, this addresses exactly what Michael brought up. Like, does it help or hurt? It depends on what the medication is or what you're taking to help with sleeping. In fact, some of this THC may actually increase cardiovascular risk. Studies indicate daily cannabis use can raise the risk of heart attack and stroke, and with edibles showing similar vascular dysfunction to smoking, which is not good at all. Yeah.
So you won't get really good rest when you take a PhD gun.
Say it again. It will what?
You basically won't get the same REM cycle.
Oh, REM.
Yeah. Sleep won't.
So I'm not sure why the student knows this much about THC.
I hate drug and behavior class.
Okay, she didn't say experimental, but it was a class she took that it can actually disrupt REM cycles, which are really important for a good quality of sleep. Thank you. That's good. But again,
Michael.
oh, Michael.
The other side. Rummy.
It's interesting, but we got to kind of weigh the pros and cons then, right? Because it's not necessarily lowering, though it seems like it should, right? Should make sense that if you're actually getting more deep sleep, then that's a better quality. I should be lowering my CV risk, but getting it through THC is actually not lowering because there's other things that are in play here for your vascular health.
Two different age groups.
Two different
that's a
age
good
groups.
point.
Good point. So again, what's the bottom line? Everyone's going to talk to their doc, right? Their healthcare team. You're going to talk to them before you take anything. So in summary, the more we learn about sleep, we are realizing the impact poor sleep has on our health in general, and specifically our heart health, right? And it's a great idea to have a discussion with your healthcare team to determine what is the best course of action to improve your sleep in a safe manner. We don't want to create a whole new problem like with THC, thinking we're getting better sleep, but we actually may be putting ourselves at a greater risk. And next week, Linda Good will be talking about sleep hygiene with other treatments that are available. So when we say good night, now after this lecture, it has a whole other meaning, right? You know, you're just like, good night. It's like, ugh, will it be a good night? So what questions do you have for me?
A lot of people. And a lot of them say you have to do a mind thing before you go to sleep, rest. And I was thinking about this, I was thinking as a kid, we said prayers before we went to sleep. And how relaxing that was. I've moved away from that. So now I revisited it and think of the things that went well today. And one of the prayers I found was actually in the old times when we had 7 prayers a day in Christian religion. And it said, for the things we have done today, it's been a good day. For the things we haven't got done, there will be another time. Not a good. And I thought, what wisdom?
Yeah.
That every day of my life.
Yeah, no, that so Nancy brought up like when she was younger, they would pray before they go to sleep. And whether it's kind of meditative, and I'm going to take it one step farther, and I'm going to again refer back to a talk I did that did a bunch of different techniques. And one of them, what is happening is that you're engaging your parasympathetic system. So when we're running on our sympathetic system, you know, we got adrenaline, we've got these hormones running through our system, we're alert. How do you turn that off? And even by deep breathing, meditation, prayer, but I specifically talked about something that the Navy SEALs did, which was, and I'm going to screw it up, but it's basically inhale for a count of 7, exhale, no, hold it for a count of 8, and then exhale for a count of 4, something like that. And it's kind of cyclic, but that transitions you, and it works from sympathetic to parasympathetic. And you do feel this, it engages your parasympathetic nervous system, which relaxes you and it slows down your mind and it actually works. Now, don't go by what I just said. I'd have to review the lecture I did last year on sleep hygiene because that's where I talked about it. Any other questions? Because I have one more little fun thing unrelated to sleep that I want to do with everybody. But any other questions about sleep? Yeah.
So you're talking, I mean, you're not necessarily talking about continuing sleep. I mean, that could be a slight break as long as you don't stay awake and
Yeah.
watch TV.
Yeah. We don't have control over that. I mean, every night, don't we go to bed thinking, I just want to sleep through the night. I just want to sleep through the night. You know, that's what I hope for. Doesn't always
So it
happen.
could be-
Yeah. Yeah. Any other questions? Yeah.
It seems to me that go to bed at night worrying about if you're gonna get a good night's sleep. That's a self-fulfilling prophecy.
And this is what this PowerPoint has created for me.
Yeah.
But deep breathing, kind of meditation has actually helped quite a bit. But I want to do something totally different for everybody. Okay, ready? And I bet you $100, each one of you, I bet $100 you cannot do this. So while you're sitting in the chair, raise your right foot and circle it clockwise. So that's to the right, clockwise. Now, while you're doing this, draw the number 6 in the air. Draw the number 6 in the air with your, anyone doing it? Clockwise and then the number 6. Okay. Your foot changed directions, right? Okay. Anyone able to do it? Okay. So you owe me $100 and you can just pay right here. Oh, so you're doing it? Cari, are you doing it?
Yes.
Can you come up here and show me?
When you put your right foot clockwise, you draw the number 6 by starting bottom and then top. So then you go like this.
I know how to read it. I just figured it out. Your foot is going clockwise. If you draw the 6.
Ah,
Inside out.
I'm doing it.
It's clockwise.
Okay, I take it all back. I take it all back. Thank you, guys.
Thank you, Cari.
You guys had great questions.
There's such a thing as being too analytical. Yeah. Especially around everything.